All right, good afternoon, everyone. Thank you for joining us. My name is Sarah Santana. I'm the Director of Student Health and Wellness here, and today we're going to talk about domestic violence and healthcare. So kind of how, as healthcare professionals, things to look out for regarding seeing patients that might be in a domestic violence situation. But we're going to do a basic overview of domestic violence and then kind of highlight how healthcare providers play a part in stopping domestic violence. So I'm going to go ahead and start sharing my screen. Um, and we hope you learned something good from today. So So this presentation was adapted from one from Florida State University. They did a presentation slash training for their prevention toolkit for domestic violence, specifically for medical professionals. So the second half of this presentation is focused on how medical professionals play a part in helping with domestic violence. So a basic overview agenda for today. So you're going to learn about the dynamics and the impact of domestic violence. And domestic violence includes the following. These are kind of interchangeable words that are or phrases to kind of use to describe the same thing. So interpersonal violence, relationship abuse, dating violence, domestic abuse. They're all under the same umbrella of domestic violence. You'll also hear or might see in the language victim or survivor. Um, so there's kind of two camps with that. Victim is kind of the legal, criminal kind of term, right? Legal term. A lot of people feel empowered being a survivor. Some people don't mind being labeled either one. There's also the spectrum, right? You might start out as a victim and then become a survivor. So kind of asking someone if you know that they're involved in a domestic violence situation, what term they prefer. But you might see that interchange throughout this presentation. Um, Understanding that domestic violence is an epidemic and it's a public health issue and it can be very costly, not only in terms of like money costs, but also cost of human life and other ways that it affects people who are impacted by this. So not only does it affect the person who is being abused, but there's a ripple effect, right? So it affects the families, the friends, the communities, the children around this victim. They're often affected physically, but there's many different types of abuse besides physical abuse. There's mental abuse, financial abuse, things like this, and they can be affected well after um, the abuse stops or they leave the domestic abuse relationship. So providing information and connection to resources is the best way to help someone in a situation and to help prevent it from happening, right? The more empowered and knowledgeable you are about the situation, the better you are to prevent this from happening. And every medical professional will encounter someone who is a survivor of domestic violence. So it is very pervasive and it's very high likelihood that you'll encounter someone who has had experience or been a part of a domestic violence situation. So an important note to consider is state laws, right? So we are in California, but you might end up practicing in another state. So it's important to look at your state's laws on what they define as domestic violence and what they enforce. And in terms of medical professionals, also understanding the mandatory reporting laws. And so we know that as healthcare professionals, whether that is mental health care, physical health care, we are mandated reporters. So in terms of children, right? So, and we'll discuss this later on in the presentation. If abuse is happening to children, it's most likely happening to other people in the home. And so it's important to know who is a mandated reporter, what are you mandated to report, how soon you're mandated to report these things, right? And you might be surprised who's considered a mandated reporter. In California, it might be across the nation, but I know that bank tellers are considered mandated reporters for financial abuse. So you might be surprised who's a mandated reporter. So even in your current role now, if you're volunteering in certain situations, you might be a mandated reporter. So you might want to ask whoever your employer is or whoever you're volunteering with if you're a mandated reporter and what that means. So what is domestic violence? So this kind of overview definition here is a pattern of abusive behavior in any relationship that is used by one partner to gain or maintain power and control over another partner. So this can happen to anyone, doesn't matter age, religion, orientation, gender, it can happen to any one of us. It can happen in any type of relationship, right? So married, dating, no longer dating exes, right? It can still happen. Just any type of relationship you have with somebody. And some acts of domestic violence aren't considered crimes. I'm thinking particularly of like psychological abuse, emotional abuse. Those aren't crimes, but they often go hand in hand with things that may be crimes or are crimes, like sexual violence and physical violence. And all of these types of violence is involved in this pattern of control. And we'll discuss that further in the presentation. So, like I said before, it is a public health crisis, right? So, when we think of other public health crises like gun violence, right, these things are preventable and involve a lot of education and awareness of the public to kind of help reduce the risk and help reduce the prevalence of this. So, these are some sobering statistics provided to us by RAINN. So, RAINN is the Rape and Incest National Network. And the CDC does or did a survey that was, I believe, the National Intimate Partner Sexual Violence Survey. That's what it is. National Intimate Partner Sexual Violence Survey. And so this is data collected from these sources. And just to highlight how prevalent this is happening, right? So about a little over every minute, somebody is sexually assaulted in America. And every 9 minutes, it's a child who's sexually assaulted. 1 in 3 women and 1 in 6 men have been stalked at some point, and more than 81% of women and 43% of men have experienced some form of sexual harassment or assault at some point in their life. So as you can see, it's a high number of occurrence that is happening. And it's very prevalent, widespread, can happen to anyone. And so it's important for us to be aware of that. So again, just kind of the numbers, right? So the amount of psychologically abused people is in the millions. Of the 1 in 4 who have experienced a type of rape or physical violence or stalking, in conjunction to experiencing those violences, they also experience these other instances or symptoms, right? So fearing for their safety, PTSD, healthcare needs, right? Injuries, needing to access legal services. So there's a lot of other things that come into play when someone is a victim of domestic violence. People who are severe or have experienced severe domestic violence lose a lot of days of work, which is a lot of money that is lost, a lot of time that is lost. It's just kind of, like I said, a ripple effect. In addition, there was almost 8,000 women who were murdered by an intimate partner in 2022. And I think particularly pregnant women in domestic violence situations are at highest risk. So kind of again to highlight the financial cost of domestic violence. So you can see here the cost of medical and mental health services within the trillions of dollars, right? And so the cost of these things include like the medical care that is needed, the mental health care, any kind of services that may have been employed, court fees, things like that, are all accounted for in these things. But these costs may be higher because it's often underreported, right? Underreported. There's so many people who may experience these things and don't go to the police about it, right? Or don't tell anyone about it because there's fear involved, there's shame, they don't know where to go to get help. So this may not be an accurate picture. So just thinking about that, right? It's such a high number and it may be, in fact, be higher because there may be people who experience this and aren't reporting it. So how does this affect children, right? So here's some information on how it affects children. So every year, there's about 5 million children who are exposed to violence. And there are 40 million adults who grew up with violence in the home. And child abuse, or the number one predictor of child abuse, is abuse, domestic abuse of women, right? So if there's a woman in the household who's being abused, this increases the risk of any children in the household being abused. And so children who are victims of domestic violence, which again, children who are being abused, that's child abuse. So there's kind of an overlap with child abuse and domestic violence of children, right? So it's child abuse is a reportable crime, right? And children who are being abused may show or present as having learning deficiencies or attention deficits, right? So if you think of yourself at a time when maybe you were very stressed or anxious, and how that affects your memory or your ability to kind of learn things. So thinking of a child who's growing up in a home where there's a lot of fear and a lot of violence and a lot of tension, it's going to affect how they learn. And so it's important to keep whichever adult is being abused in the home safe, because that helps keep the children safe. So further effects, so children can be resilient, and we can't just rely on their resiliency skills. We have to keep them safe. They also learn to cope with things in different ways than adults, right? But children who live in a domestic violence situation have a lot of fear. And even if it's emotional violence, they're going to present the same way as someone who is physically abused. And so the traits or the behaviors they establish in childhood, so whether that's maladaptive coping mechanisms or just ways of thinking, can continue on into adulthood, and they themselves may have difficulties in relationships as they grow older. And so in 2022, there's about a 7.1% prevalence of abuse or victims of abuse in children and adolescents. So it's a pretty big number. So one thing to kind of remember is there may be a lot of myths or a lot of misconceptions about people who are in a domestic violence relationship. And so we're kind of going to debunk these myths or correct these conceptions. So someone might say that they deserved it, right? If they didn't get me upset, this wouldn't have happened, right? So that is a myth, that there's no situation where someone deserves to get hit or abused. So this is just a justification that abusers will use, and there is no justification for violence in any type of relationship. Another common one is you can't rape a significant other. Rape can occur whether you're dating or married or engaged. It doesn't matter. You always need to get consent from your partner. So marital rape does occur, and it's important that people understand that, right? That if you're in a relationship, it doesn't mean the other person is entitled to get sex from you, right? So you should always ask for consent. You're always allowed to say no, and no is a complete sentence. Someone might justify by saying I was teaching her a lesson, right? In fact, in terms of childhood development, but even with adults, violence is never a productive way to get somebody to learn something or to correct behavior. So it's not a productive way to teach somebody something. Again, this is a common justification that abusers may use. It's a myth. It doesn't work. And again, it's not acceptable. Violence is never acceptable in any relationship. Someone may say I was drunk or high, right? They're under the influence. I didn't know what I was doing. So with being under the influence of a substance, it lowers your inhibitions. So what that means is someone has these thoughts or feelings or this pattern of behavior that they're controlling when they're sober. And then when they engage in substances, they let go of that control, right? And so it's not an excuse for someone to engage in violence. It actually increases the risk that violence may occur, and it increases the risk of fatal violence, right? Often people don't understand or realize the strength that they might have. They are more impulsive when they are under the influence, so it makes it more dangerous, but it's never an excuse or a reason why someone engages in it. This is kind of an outdated myth, right? They're gay or lesbians, so it's not domestic violence. So not too long ago, LGBTQ relationships weren't validated, right? They weren't seen as real relationships. So there was this idea that, well, violence can occur in those relationships, or because it's not a heterosexual one, like which one is going to be the abuser, right? So actually, in reality, this population, this community is at higher risk of being victims of domestic violence. And again, as we said earlier, anyone can be abused and anyone can be an abuser. So it doesn't matter what type of relationship you're in, it can happen to anyone. So some more risks, right? So women are just as likely to be abusers. So this one's kind of a tricky, nuanced one. Yes, women can be abusers. However, there's still the fact that men are more likely have a higher rate of being abusers or batterers than women. And women are more often victims of more severe types of abuse and violence. So yes, women can be abusers, but men still have a higher rate of being abusers. Often someone or an abuser might say it was a one-time thing, right? This will never happen again. Um, and usually it becomes a pattern, right? This may be the first time you've seen it in your relationship, but it may not be the first time this person has done this type of behavior, right? So, and again, one times is too many times, right? Um, we shouldn't be making excuses for being slapped in the face or pushed or anything. These are little red flags and warning signs we need to pay attention to. And if we have a pattern of forgiveness, it kind of lets this person understand I'm going to, this person's taking this behavior and it may escalate. So it's important that if you're in a position or in a situation where you're seeing these things, finding a way to get out of this situation before it gets worse. So kind of leading into this next one, right? If it was so bad, she would leave. And we'll go into why it's so difficult for people to leave domestic violence situations. It is not easy. There are a multitude of reasons why someone might not leave. And in fact, I think it takes, on average, someone 7 attempts to finally leave a domestic violence situation. So to you, it may seem like this person isn't trying, but they may have tried 3 or 4 times already, right? So we don't know the ins and outs of why someone is staying, but just understanding and knowing that it's not as easy as it seems, right? That if you've never been in a situation like this, it can be hard looking out in, going, why would this person stay? So it's very tricky, but we'll go into why it's difficult to leave. Some people may think that mental illness causes people to be violent and domestic violence. So being abusive is not a mental illness. Abusers or victims may have mental illnesses, but it's not an excuse for violence. And in fact, people with mental illnesses are oftentimes more, they are more likely to be the victims of violence than the perpetrators of violence. So it's important, again, to not make excuses for people who are engaging in violent behavior. It may be a contributor or a risk factor, but it's never a blanket excuse or justification for why someone should get away with these behaviors, right? This is not something we should be excusing or forgiving or kind of shoving to the side and going, well, there's a reason why they're doing this. So kind of getting into what abusers do that keep their victims like under control, right? So the violence, the emotional, physical abuse, the psychological abuse, this is all to have control over their partner. And they use a lot of fear and intimidation tactics to do this. they're done on purpose, and it's meant to contain this other person, right? And it can be difficult to kind of break this cycle. And so I'll go into what the cycle is and what tactics they use. So this is the cycle of violence that makes it very difficult for people to leave these situations. So I'll start here on the left with this honeymoon phase. So this is a everything's okay phase. You're doing pretty well in this relationship. Nothing to note, right? But then tension and stress start to build. So maybe something bad happened at work, or it's, I'm running a little short on money. I don't know if these bills are going to get paid. So stress is starting to build. The victim may find themselves feeling like they're walking on eggshells, right? So they are being very hyper vigilant about what they're doing around their partner because they know what's coming next, right? So there's this standover phase. So the tension is building. There's a typo here, and then it explodes, right? So this explosion can be the physical violence, the sexual violence, um, whatever violence the perpetrator or the abuser engages in, it occurs, right? And then afterwards, it can be immediately afterwards or sometime afterwards, there's this remorse phase where either they justify why they did it, right? Well, if you didn't get me upset, I wouldn't have to do this, right? They may minimize it. It's not that bad. I didn't leave a mark. Or they may guilt you, right? Again, the self or blaming the victim, saying, if you hadn't done this, well, you should have known better, kind of thing. That can be followed by this pursuit and promises phase. So, making apologies. I'm sorry, it won't happen again. I love you. But gift giving, right? Being just extra kind and nice and leading back into this honeymoon phase. So this cycle just kind of reoccurs over and over. Everyone's timeline for these cycles could be different, right? This could be happening every week. This could be happening, every other month, right? And I think this kind of adds to the difficulty of victims leaving their abusers, because if this is happening, once every 3 months, uh, our attention spans and our memories, we may forget about how bad was the last time, right? How long ago was it? And we tend, or they tend to focus on the good parts of it, right? Well, they've been so sweet to me. They took me out. They bought me things. And that kind of overshadows the bad parts. And they want to focus more on the good, because at the same time, it becomes difficult to believe like this person is hurting me, right? This person scares me. Sometimes it's hard to reconcile inside of yourself. Like, how do I hold these two things to be true, that I care about this person, but they also scare me and hurt me, and I don't like that. So this cycle kind of makes it difficult for people to leave. And within this cycle is this power and control wheel. So when you look at this, in the middle of this wheel is the power and control, right? And the spokes are the different tactics they use, and the actual wheel part is surrounded by this violence, right? Whether it's physical or sexual violence, or the emotional one. And so they may use tactics like intimidating, just blocking your way, um, maybe throwing things or talking about having weapons, right? So coercion and threats, they may threaten to hurt you or threaten to kill you or kill themselves, right? They may play on the person's emotions and go, well, if you leave me, I'll just kill myself, right? So they use these different methods to keep someone isolated, to keep them feeling guilty, right? If I can make you feel like what I'm doing is your fault, then I can keep you around, right? And I can just keep blaming you. And you're going to feel bad about making me upset, and you're going to want to stay around to make me feel better, right? So they kind of play on these things. And in a way, the victim is being brainwashed, right? They're being gaslighted, they're being manipulated into believing that it's all their fault, that they may deserve this, that no one's going to believe them if they try to leave and tell somebody. And so that adds into the factors of why it's so difficult for people to leave these situations. Um, Especially like the isolation and the control, right? The economic abuse. I talked about financial abuse. If someone controls your money, right? They control your credit cards, your checking accounts, they look at your phone, they, are monitoring who you're calling. That makes it even harder to get help, right? Because how do I contact somebody when someone's watching, who I'm reaching out to? Um, and I will say that some of this stuff is becoming normalized. I'm seeing a lot of it in like these TikTok social media trends. And one thing that I've noticed that's being normalized is like the sharing of locations, right? And so if you're using that with your partner for safety reasons, right? My sister-in-law takes the train, and my brother will just watch her on the train because he picks her up from the station. So he just watches her to make sure where she's at and knows when to go pick her up. If you're using sharing location for safety purposes, by all means do it. But if you're using sharing location to kind of monitor where your partner is going, to keep tabs on them, and you get upset when you see like, why are they spending so much time at this place, or they should have been home by now. We need to look at that, right? Are we using sharing location as a way to control our partner, or are we using it as a way of, this is how we keep each other safe? We know where we are. But that's an example of something that can be used for control that's being very normalized now. And I think we need to be very careful about these types of behaviors. Um, Another thing is just like playing these awful pranks on your partner and getting them upset, right? Having them have a reaction. I know a lot of that is just for views, but we need to be careful if that's a pattern, right? That someone thinks it's funny to hurt us. It's never funny to have violence be put against you. So things to be mindful of in your own relationships. So the different types of domestic violence, it's more than just sexual or physical violence. There's verbal abuse, stalking, and the psychological part. And again, all of these can be used as a way of control and intimidation. So physical abuse is the intentional use of harm, and it could result in injury, disability, or even death. So it's important that anytime you're being physically abused, pushed, hair pulling, things like that, uh, we need to be mindful of this and understand that these are not healthy behaviors to engage in a relationship. And particularly things like strangling is if someone engages in strangling, so maybe your partner may put their hands on your neck. Maybe they didn't strangle or start choking you, but they put their hands on your neck. It's a high indication that they will do it again. And that's a very fatal behavior to engage in, right? So a lot of victims of abuse die by strangling. So it's important. That's another kind of red flag behavior that if you ever noticed someone doing this or it's ever happened in your relationship, it's important to think about, how am I going to leave this relationship? Because it could result in death. So psychological and emotional abuse, this is a very common type of abuse. This abuse can happen without the other ones. What's sad or difficult about this one is it's often not a crime to engage in these behaviors, right? You can't call the police and say, well, they're calling me names. So I think that's what makes this one of the kind of worst types of abuse, because how do you enforce or get someone to stop doing it, right? And this is again the brainwashing part of the abuse, right? So humiliating this person, putting them down, diminishing their self-esteem. This is another tactic that's used to keep someone engaged in their domestic violence relationship, and all these other things. So sexual abuse, right? You can have the physical abuse without the sexual abuse. So there's any type of sexual behavior or touching that is against somebody's will. They're being forced to engage in this, right? And this can include making or forcing to watch porn, forced pregnancy, right? Maybe this partner doesn't want to get pregnant, but their partner is forcing them to get pregnant. Um, and reproductive coercion, right? So this is a sneaky one. So this may be um, tampering with birth control methods, right? So hiding medication or forcing someone to take medication, um, damaging condoms, right? So anything that kind of tampers with reproductive health. And again, it's taking somebody's agency or ability to decide for themselves. It's, I'm going to determine if you engage in this or not. That's a sign that someone's being sexually abused. So economic and financial abuse, right? So if an abuser controls finances or money over their victim, or ways that they can make money or control their own finances. So there's a lot of different ways this can occur. Um, so, holding credit cards or debit cards, right? So managing somebody's money, um, making it difficult. So the opposite can occur, like making them difficult to keep their job, um, or refusing to work, right? Like, no, you're going to be the one that works and I'm not going to do anything, right? Like you're going to have to be the financial head of the household. Um, so there's a lot of different ways that this can occur. And so basically, abuse is happening if someone doesn't have their own voice or say in how they manage their finances, outside of they can't do it, right, for developmental reasons or they're a child. So verbal abuse, again, this humiliating, this threatening, telling the hurtful jokes, any kind of down talk to a person, anything that just would make anyone feel bad can be verbal abuse. And again, talking about a pattern of this, right? That this is how they often talk to their victim or about their victim. Stalking, right? This is often, I think, one of the more underreported behaviors. So threatening behavior, someone's being followed, so whether it's physically followed or technologically followed, right? I think the next slide goes over the cyber stalking. It can include vandalizing property, leaving gifts, right? Or putting notes, maybe like leaving a note on your car saying, "Hey, I see you," or "Hope you have a good." It can even be like, "Hope you have a good day," right? If you don't want to engage in communication with this person, but they leave you a note, that's still stalking, right? They found out where your car was, they left you a note. Um, and so cyber stalking, same thing, just through technology, right? So monitoring the sites, they may harass you, leave a bunch of comments on your social media. They may pretend to be you through social media. So it's important, that's another thing, people share each other's passwords and accounts. And sometimes that's just, you trust the other person and it's nothing. But if this is a part of this pattern of behavior of control, it can be difficult to manage this if someone has your account information. So common characteristics of abusers, and this is something we're starting to get into the healthcare field, what medical providers and healthcare professionals should know about, right? So again, talking about not all abusers are going to have mental health issues. And again, even if they did, it's not an excuse for their behavior. Abuse is not caused by stress or anger management. They elevate the risk of it occurring, right? But they are not, if somebody's stressed, they're automatically going to be in an abusive person, right? We've all experienced stress without violence. They will often deny responsibility, and people can choose who they want to abuse, right? They kind of look for certain characteristics. They may look for someone who maybe doesn't have a lot of social support and it makes it easier to keep them isolated. They may choose someone who has low self-esteem, right? And so when this abuser starts um, complimenting them and uplifting them, it becomes like, oh, this person sees something in me. And then it's coupled with the violence, and that's where it becomes challenging. Abusers may have substance abuse issues. Not every abuser does. And again, they don't go hand in hand, but the substance use and abuse can elevate risk of abuse happening. I think another thing to consider is if you're treating somebody and their partner is in every appointment, right? So it's hard to get this person that you're treating alone, or the partner answers questions for them, right? That's kind of a telltale sign that, hey, this person is controlling the narrative, right? They're answering questions for this person. They're obviously kind of keeping certain information out of the light that they don't want the medical provider to know. So what does it look like on the victim end of it, right? So again, many victims feel helpless. They feel like they can't leave the situation. They may feel shamed or embarrassment about it, right? And so that may be a reason why they're not telling anybody, because what are people going to think if I tell them, this has been happening for so long, right? They may fear for their safety and the safety of any children that they have, pets, belongings, other people, right? If their partner has said, I'll kill your dog if you ever leave me, or um, I'll do harm to your family, they will believe those threats. And so they stay, because it's like, well, I love my family. I don't want anything to happen to them. So what are the consequences of domestic violence, right? If you're in a domestic violence situation, these are kind of the overarching consequences that they occur, and they're multifaceted, right? They're in different areas of our lives. So they're the obvious health ones, right? The chronic pain, um, there might be gynecological or like genital problems if someone's being sexually abused, gastrointestinal, right? This is a common type of problem when you're feeling a lot of stress and anxiety. A lot of us feel it in our stomach, in our guts. And so if you have these chronic kind of problems with it, it could be a sign or a consequence of domestic violence. There's the mental health aspect of it, right? So anxiety, depression, PTSD. Victims may also use substances to cope with the domestic violence they are experiencing. So again, here's some reasons why victims may stay, right? So the fear that violence may get worse, right? So they may stay because they're afraid it's going to get worse. There's going to be more violence, that they're going to get killed if they leave, or other people may get killed, or again, the abuser may threaten to kill themselves if they leave. They may be isolated and not have resources, so they may not have the money to leave, right? If they don't have control over their money, they may not have the money to leave. They may not know who to go to ask for, or anyone. If they're isolated, right? Maybe they moved and all their family is in another state. Where are they going to go, right? Who can help them? And also understanding that when somebody leaves, it's the most dangerous time for them when they leave. And so I'm using women here because, again, they're at the highest risk of this. But you're at the highest risk for serious injury or death when you leave an abuser. And there's a 75% increase of violence once you leave. And that can last for up to 2 years after you've left this relationship. So that just goes to show that this fear of leaving, or the difficulty of leaving, is not unfounded, right? If your rate or risk of death escalates that much when you leave, it makes it so much harder to see the benefit of leaving, right? It's kind of staying with the devil, Um, so again, why other ones don't stay, or why more reasons why victims stay, right? So this lack of support, whether they're being afraid because they're ashamed and embarrassed. Family, depending on the type of family you grew up in, right? If you had domestic violence growing up and then you end up in a domestic violence relationship, it may be normalized. Your family may be like, that's normal, right? We've all done this before. And so it may be harder to leave because you don't have anyone who thinks otherwise, or who validates this experience for you and says, no, this isn't safe, right? And then beliefs and feelings. Religious beliefs is important, right? So some people have very strong religious beliefs, and they may be shunned by the community if they leave their partner, even if abuse is occurring. So we need to be aware of these things and empathetic of these things. We can't just write people off for going, well, they're doing it to themselves because they're staying. There's so much nuance to why people stay, and we need to be understanding of this. And again, it takes a while for people to leave. So we don't know how many times this person may have attempted. And we need to be patient with people. So how do people, victims cope? They may minimize or downplay. They may deny it's even happening. They may rationalize that it's happening, right? Like, oh, it was my fault. You know, they were very stressed and I should have known they had a deadline and I shouldn't have done these things, right? So they may rationalize, make excuses. They may numb themselves with substances, and they may engage in the self-blame that is reinforced by an abuser, right? So how do we avoid negative reactions, right? So as a medical professional, if you encounter someone who is in a domestic violence relationship, we can't contribute to this blame and shame, right? It's only going to make it harder for them to ask for help. So not labeling someone as non-compliant if they're not leaving, or thinking that they're putting themselves in a risky situation. We need to be mindful and understanding and patient with these people. So how do medical professionals contribute to the prevention of domestic violence? So education is like the number one thing, right? Education and awareness. If you understand like, hey, this behavior isn't normal, or it's not healthy, or I don't have to be in a relationship where this occurs, and the resources to help someone get out of these situations, that makes a world of a difference. So what medical professionals can do? The number one thing you can do is screen for it. I'm not going to go through all these medical associations, but as you can see, it is highly recommended from all these medical associations that medical professionals should screen for domestic violence when they're meeting with patients. And this should be kind of a standard, and not like, oh, I'll only screen with women or whatnot. It's everyone should be screened, right? And so I think Mariah put it in the chat, this video. I don't think we'll have some time, but it's a 30-minute video. And it's got 5 situations, or 5 like screening scenarios. So you can watch a doctor screen a patient and ask the screening questions about domestic violence. So here's some examples, and there is a website by Stanford with more examples of questions. So if you want to practice in maybe your clinical site or something, these are questions that you can ask. So there might be a written screening, that happens in a practice, and there might be a question asking about feeling safe with a partner. So you want to follow up on any type of screening that might be occurring on a form, an intake form. You want to follow up with that and let people know that, hey, I'm a safe person you can bring this up to, right? Especially the doctor-patient confidentiality, right? That can make someone feel a little more comfortable with opening up, understanding that, hey, this is going to stay between me and my doctor, right? You can ask someone, are you afraid of your partner? Do you ever feel in danger? How does your partner treat you, right? That one's kind of very open-ended, and it's not leading someone, right? They could say, oh yeah, they treat me fine, or sometimes we argue and he, pushes me. You can ask, what kinds of violence have you had in your life, right? So this is kind of like a lifetime screening of, have you ever been a victim of violence at all? Again, these open-ended ones can make it a little easier to have someone open up about it. And then, have there ever been situations where you felt afraid? Let me check the chat real quick. Okay. Oops. So again, what can medical professionals do? So understanding the dynamics we went through, right? Explaining domestic violence to patients and providing their information. And I think just the number one thing is being understanding and patient with them. Making sure you evaluate your own kind of ideas about victims of domestic violence, and being kind of knowledgeable about the resources that are available. So knowing your shelters, right? So it might be good to just, find a list of shelters with, in your county or something, having that printed out and having that in the office, right? So having this list of shelters ready. And if you are someone on campus that needs access to that, you can always reach out to Shaw to get a list of shelters. Injunctions or court orders, the best thing is to connect them to a police department. So knowing where your nearest police department is and getting them connected to that, having the contact information. Crisis intervention. So that's crisis hotlines. We're going to show the hotline number at the end of this. I actually just put the hotline number in my phone. It might be good to just put hotline phone numbers in your phone so you can just have it readily available to give to somebody. Advocacy, right? So maybe in your place of employment, your practice, you're like, hey, I've noticed that we don't have a lot of resources available for domestic violence victims, or we're not screening them or whatever. So being able to advocate that, hey, we need more resources and support for these victims. And you might want to collaborate with other people in the practice, right? Or if you're like in a hospital setting, social workers and things like that. Coming up with a safety plan. So there are websites that can help you come up with a safety plan, or it can just be as easy as asking somebody like, who do you feel safe with, right? If you had to leave in the middle of the night, where would you go? If you had to leave in the middle of the night, who could you call to pick you up, right? So just kind of asking those questions can be a safety plan. But there are like formal safety plan sheets that you could do it, or you can connect them with the domestic violence hotline and someone there can help them create a plan. And then law enforcement. So again, some people may be adverse to calling law enforcement. They may have had bad interactions in the past, or maybe police have visited before, but they haven't been helped, right? Like nothing good has occurred when the police have been called. But understanding that as a mandated reporter, there are going to be some instances, again, right, if there's child abuse, that you have to involve law enforcement, and just letting somebody know, hey, you mentioned child abuse, I have to call the police or I have to inform law enforcement. And as mandated reporters, there are timelines on when this has to be reported. So understanding what that timeline is and your role in that. So this is the domestic violence hotline. So if you or someone you know is in need of help leaving a domestic violence situation, you can call this number or you can text this number. And again, it may be a good idea to put this number in your phone. You may never know when in your lifetime you may need to give this to somebody. So you can put it in your phone. If you're concerned or you have a partner who monitors your phone, you may want to save this under like a fake name, right? And just kind of keep it so that this person doesn't get suspicious. If you're concerned, if someone goes through your phone, if you're concerned about them finding out who you're calling, you might want to put this under a name. So through all this, some important things to remember, right? Domestic violence can happen to anyone. It is a preventable health problem, right? If we can be educated, if we can give people assistance, early intervention, right? If we can reach people early on in a domestic violence situation, it can help people get out, right? And medical professionals should be willing and able to inform patients about it, screen about it, and give them resources about, help that's available to them. So I want to thank you all for participating in this. If you are someone who has questions or you need assistance reaching domestic violence resources, I encourage you to email us or call us. If you call us, please leave us a message and we'll return your call. Do not leave any sensitive information on the phone, but you can email us or call us and we'll get you connected to services. And that's all the references we have, but thank you all for joining today.